Hi, Paul Sackers, Good News Broadcast, speaking to Dr. Gregg Lituchy. Hi, Doctor. How are you?
Good. How you doing?
All right, real well. I've met the doctor before. I think I interviewed you once. I was up at your place on 59th Street. You have a
right on Central Park South.
Cosmetic dentistry. He works with many superstars and fixes a lot of beautiful teeth. And we're talking today about cash-strapped American. Are they neglecting their teeth? What are some kinds of things they can do? And February 9th today is the National Toothache Day. Okay, so
how scary is that?
That doesn't sound like good news. But so, what are people neglecting, and what should people be doing?
Well, as you know, we're in a bad economic situation here, and Americans are not only cutting back on food and travel, but really on their health, and in particularly their dental health. So the question becomes, if you can't afford to go to a dentist now and have your teeth checked out, what is that going to mean down the line for you financially, and what solutions are there to that problem to deal with it?
Okay.
And it's a scary situation. So the problem is, when you go to the dentist, normally they would find a cavity in your mouth or a couple of cavities and say, let's take care of that, and it will cost you a couple $100. You leave that untreated, a year and a half from now, that tooth could possibly need a root canal, and if you have a root canal, then you also would need a crown and maybe a post, and all of a sudden you're spending thousands of dollars when you really can't afford it on something that would have cost $100. So the question is, what do you need to do at home to deal with the situation? And what I've been telling my patients that do come in, and by talking to you today and to other people to try and get the word out, is I'm telling them they need to change what they're doing at home and how they're doing it. In other words, brushing and flossing, you have to brush twice a day. You got to do it for 2 minutes, at 30 seconds per quadrant of your mouth, per quarter of your mouth. Each time you brush, you need to brush the right way, which is to brush from the gum line down towards the tooth on the upper teeth, and on the lower teeth from the gum line up towards the tooth to get that plaque away from the gum line. You need to floss properly, which is wrapping the floss around your fingers, popping through, and then wrapping it around the teeth to remove the plaque. But you know what? If you're not getting to a dentist, that's really not enough anymore. So what I'm saying is to add something to your home regimen, which is to rinse twice a day for a full minute with an anti-cavity fluoride rinse, such as Listerine Total Care, which also gives you other benefits too. And what I love about this product is the fluoride gets into your enamel and it replaces the calcium that's in your teeth with fluoride. Well, fluoride is much harder as an ion compared to calcium. So the bacteria that live in our mouth, and we all have them, they have a much more difficult time eating through your enamel through the fluoride than they did through the calcium. So what you're doing is you're slowing down existing cavities you may have at the time, and you can't go to the dentist. You want to slow down that process. And you're also helping to prevent the start of new cavities. So in essence, it's really strengthening your teeth. It's restoring your enamel. So, we have other priorities now. We have children. We have to feed our family. So, you can be the most conscientious person in the world that always went to the dentist twice a year, had the plaque removed by the hygienist, and checked things out and took care of it. But you can't always do that now. So if you change what you do at home, if you do things that you've been doing at home and learn to do them with proper technique, and I always tell patients, if you want to find out really the right way to brush and floss, and you can't get to your dentist now financially to ask them, you can always go on the website, the American Dental Association's website, which is www.ada.org, to find out great tutorials on how to brush and floss. And likewise, the fluoride rinse, it's a must. You can always go on www.listerine.com to find out about their Total Care product, which is great. And really do everything that you can at home to compensate for the fact that you're not getting to the dentist for financial reasons right now.
Okay, and you have a website too.
Yeah, my website is Lowenberg, Lowenberg, and A-N-D, my name, Lituchy, Lituchy, .com. And we are a cosmetic practice. We do, veneers, bonding, bleaching, and those things. But you know what? Even as a cosmetic dentist, I don't do anything on anyone's mouth until I know that that mouth is in optimum health. The gums, the teeth, the decay taken care of, then you can go ahead and do the cosmetic work, which, believe it or not, in this economy, there are a lot of people who have lost their jobs and need to go on job interviews and get out there again and try and, become employed. So there are people that are still coming in. They still want to do some bleaching. There's great over-the-counter products for whitening as well. If financially you can't afford to get your teeth whitened at the dentist, there's great products out there that you can use to help give you a nicer smile to make you at least feel more confident in trying to get that new job or going on that blind date or whatever you're doing in your life.
Let me ask you a question, because with mouth rinses, okay, and washes, I know you mentioned one, a total Listerine, but there's different I see antiseptic, non-antiseptic. There's an array, and there's an array of different levels. That kills germs. Some that say 99% kills germs. What is the reality here?
Okay, there's all different rinses out there, and you got to be careful what you get. There are mouth rinses out there that just freshen your breath for a few minutes, and that's the end of it. They have no fluoride in it, and that's what I like about this Listerine Total Care, is that, in addition to freshening your breath and killing the bad germs, it's got the fluoride in it, and you got to make sure it has it. Listerine Antiseptic is a wonderful product to help reduce the plaque and the gingivitis and the germs in your mouth, and it removes, 52% greater plaque reduction, in 6 months than just brushing and flossing alone. And you can use that, with the Fluoride Rinse. You can rinse with both. That's okay. But because of the fact that the economy is bad, because of the fact that money is not being put into going to the dentist right now, it's the fluoride aspect that I really feel is so important at this point. Remove the plaque with the good brushing, remove it with the flossing, use an antiseptic mouth rinse, preferably one that's recommended and has the seal of the American Dental Association on it. But you also need a fluoride rinse. So when you go out there to buy something, you want to make sure that it has the fluoride in there, because we have to slow down the decay. We have to prevent the decay until financially this economy turns around, and hopefully President Obama and his team will get this turned around soon enough that we can all take care of our dental health and our medical health and get back to the lives that we're used to living.
Okay, Doctor, thank you very much for sharing good news. You always have it, and you're always open and desiring to share it with people, so I appreciate it very much.
That's my pleasure, and I'm glad to try and educate people and get the message out there.
Great. Okay, thank you, Dr. Lituchy.
You're welcome.
Bye-bye.
Bye-bye.